much, and it's a pleasure to be here. So the context for what I'm going to say is the two agreements that I gather were mentioned earlier. That's the London Health and Care Collaborative Agreement that was drawn up in December, and that's the agreement between the London partners. And of course, that drew on the fact that London was in a strong position as a result of things like the London Health Commission and the work that's been done in the past together in London to look at how we might reform and move on health and social care, and of course the context of the 5-year review. So we had an agreement between us about how we might proceed, but also crucially an agreement with government. So agreement with the national bodies and with national government, of course signed by the Chancellor, that brought together our more London-centric view on reform and transformation with agreement from national bodies right across the board about the sorts of things that we might look at in that context. And you'll see that that's quite extensive. And I don't make any excuse for going back to that agreement, because I suspect that we will constantly need to check our progress and our joint working together based on the accords that we concluded last December. What are we trying to do with devolution? In essence, we're trying to come up with a mechanism for ensuring that we're able to tackle any barriers and any blockages to transformation which will reform health, well-being and social care as a means of service delivery and of advancing the health and well-being of Londoners. So it's a relatively simple concept, although clearly much more complicated in its execution. And what are the overriding principles that we bring to that process? And I'll start at the bottom. And I think subsidiarity is an absolutely essential mechanism that we're seeking to both hold by and indeed embed in the approach that we take, which is that we will operate at the lowest level that we can, that is consistent with the aims that we have. And that is crucial because none of this process is seeking to override what is properly undertaken and decided at the local level. Sharing is absolutely critical, and again that's sharing between London partners, sharing between London partners and national agencies and the government. Unless we share in an honest and open way where we are, we actually won't unlock some of those barriers that we perceive to be in the way of progress. Enabling, we're trying to make stuff happen. That's essentially what this is for. That's why everybody's giving up their time and effort to drive this forward. We need to make change happen, and change will be co-developed. So part of the process is a development of a business case for devolution. But it's not intended to be a sort of gateway that we arrive at separately and then there's a huge hurdle to overcome. It's intended to be a co-developed process where everybody recognises what that business case needs to do in order to allow us to progress devolution. And that's a crucial part of the deliberations at the programme board, which I chair. And lastly, engaging. Clearly, engagement with those who depend upon are part of the service is a crucial part to ensuring that our devolution propositions are well grounded and indeed have a good chance of success when they can progress. So enabling is a crucial part of the process. Within the inner circle, we have there the three key themes that we're pursuing in terms of the London devolution proposition, which are prevention, integration and estates, and then right at the centre where we're trying to get to. So it is the health and well-being of Londoners, and we should never lose sight of that as our goal. So how are we doing this in London? London is a big, complex system, not least obviously in relation to health and social care. Transforming that system in one go is a big proposition. The idea is to test out different elements of devolution in different places, which our panel represents here, and to, on the basis of that, as seamlessly and as quickly as possible, secure devolution propositions that address some of those barriers that I talked about, and indeed that we'll talk about in relation to questions later. And then to make that available as much in real time as possible for the whole of the capital. So it is very, very important that devolution is not seen as some separate process from all the other transformation and reform that you and others are engaged in pursuing. Where are those pilots and which ones are looking at particular issues? All parts of London were invited to come forward with propositions, joint propositions, and we have 3 pilots looking at various elements of integration. So that's Barking, Havering and Redbridge, Lewisham and Hackney. North Central London looking particularly at estates, and Haringey looking in detail at prevention. And in the programme board, what we've been doing is doing deep dives into each of those issues, assisted by the pilots, but also designed to assist that process. So offers of help and co-design have been the order of the day, and trying to make sure that that doesn't just come forward at the programme board meetings, but that's part of the infrastructure that we have for driving forward each of these propositions. And just really to emphasise my point about devolution not existing in isolation from obviously the whole range of other initiatives and developments that we have. This superimposes those devolution pilots not only on the NHS vanguards, but also on our structure for STPs, the strategic planning groups that are taking forward those plans. And it's very much my view that the devolution propositions need to sit right in the centre of each of those STP processes. And certainly that is what we in London as a system are seeking to achieve. We are, as I've emphasised, very interested in everybody's ideas about how we can drive forward devolution. I think there's a great deal of potential and opportunity for everybody, but it has to be designed with the expertise that we have in London, which we're extremely fortunate to have considerable expertise, in order to come up with solutions which suit the particular needs of different populations and different localities. So I will finish there, and I will invite each of the pilot authorities and our panel to say a few words about their proposition, and then we will move into the question and answer session, if that's all right. So my first task, I think, is to introduce the panel. So on my immediate right, I have Cheryl Coppell, who's the Chief Executive of the London Borough of Havering, and is clearly leading with others the Barking and Dagenham, Havering and Redbridge integration work. And then next to Cheryl, I have Aileen Buckton, who is from Lewisham. She's the Executive Director of Community Services, and the Lewisham pilot, as I said, is looking at integration. And next to Aileen, we have Daniel Waldron, who's the Director of Organisational Transformation at Homerton University Hospital, and is a leading figure in integration in Hackney. And then next to Daniel, we have Dawn Wakeling, who is the Commissioning Director for Adults and Health in the London Borough of Barnet, and a leading light in the North Central London work on estates. And then lastly, but by no means least, Janelle de Gruchy, who is the Director of Public Health for Haringey, and as I mentioned, Haringey are pushing forward on a whole range of very interesting prevention initiatives.